Let's talk about the dental laboratory. By the way, I'm not a dentist. I'm a dental laboratory technician. So I'm working with a dentist nationwide. Uh, how can you find it great laboratory? Because all about the patient teeth. They want natural as possible. They want pretty as possible. They want nice teeth as possible, regardless partial, one missing teeth, two missing teeth, one implant here, six anterior cosmetic cases, full mouth implant or six implant, whatever. How can they find it? Well, you cannot find it easily. I'm sorry, because dentists can choose dental laboratory. For example, like I said, we are Illinois in dental laboratory in Naperville, which is a beautiful town. And doctors select laboratory because probably I do a lot of social media and YouTube, just like today. And then they consider the cases if they really want to do a good job, or they're happy that they're not going to looking for the laboratory. The laboratory probably there's out there. I would say 6,000 dental lab. Even nowadays, dentists set up the dental laboratory in their building. So, laboratory technician, either working with a dentist, which is some dentists love it, or some technicians love it. But pros and cons are always. The meaning is if I'm a dental laboratory technician, and then I don't want to work with a dentist directly because you don't get much information. I mean, you get a lot of information, but you don't get much great technical skill. For example, in order to make the good teeth, the shape and contour and color mapping, texture, design, everything is hard. Because just like more likely a doctor's course, meaning they don't have any dental laboratory course out there, especially United States. They only has a certified dental technician if we want to. Probably can pay $2,000-3,000 to get the test, and then you got in Air Force book. You can take a look at it, and then you have a sample. You finish it, so you get a CDT, certified dental technician, which is I was too. But now I don't need those things because I made so many educational video daily basis, right? You see my Facebook, Instagram, TikTok, YouTube. You see it's my all different cases, most likely high-end cases, trying to make the patient happy as much as possible with a different situation. For example, doctor placed implant wrong, and some dentists and some technician blame me. You know what I told them? Someone have to figure it out, right? Not like this, 3 implant, you cannot do that. 4 implant, you cannot do that. But we do so many difficult cases correctly, better, and then we give them convenience. Patient don't have to pay more, but of course our fee is expensive. It's not cheap, not like normal laboratory. I'm sorry, but posterior was fine, but anterior implants, kind of full mouth is kind of pricey too. So in order to get the good laboratory, you should have to ask the dentist. Usually, dentist has 4 different laboratory they has, which is no problem because just like restaurant shopping, right? So they like the seafood, they like Japanese restaurant, they like the steak, they like the busy, just like that. Or they're working with the insurance, right? Unfortunately, United States has more insurance. Even though good dentists, they cannot afford dental laboratory fee. True, sad. So HMO is very cheap price. PPO is very low price. So dentists cannot afford it. But I'm trying to let patients know if you really care about the teeth, you can ask the dentist. They can use a private lab. So you have to pay your pocket instead of the insurance, which is fee for service. Because this is your teeth, right? Better than this, right? Then you have to spend time and spend money, and with the appropriate the dentist, which is the qualification, right? So preparation in order to make the good. But our laboratory either is a bad preparations and okay preparations, I give them as best as possible. Kind of a selling, but hey, that's why I spend time here. Um, Trying to help the dentist and also patient too. Believe me, the patient contact here is more than 85 patients a month. So they're looking for the dentist. So what we do, we're trying to connect with our client bases nationwide. But honestly, I don't know the patient background. I don't know what is the background. They pay well, or they pay on time, or what their problem, because I'm a dental laboratory technician. I cannot see it, so I can recommend to the dentist so they can figure either partial or implant or denture cosmetic restoration, so they can contact the doctor so we can help them as much as possible with their appropriate their budgeting. So in order to make the great dentist, you have to research first, and meaning you have to Google it, doctor's name. You have to Google it, my name, my company, LSK121. What is this company? What they'll do? Do they do A type? Do they do B type, C type? Just look at it, all their background, meaning not only photo, the video, maybe testimony, whatever, but some doctor's testimony is wrongly because I response them because they order everything from the vendor, so they don't want to pay. It's not right. And some of dentists, they do because they don't pay. Because think about it. When you go to Walmart store, you bought the TV, right? You don't like it. Then you don't want to return, but you want the money back. Don't do that. You cannot do that. Just return what you have, right? You just bought it, and then you get the refund money. But some of the dentists, they do. I don't know why. It's they send it out collection, but it's not pleasing the game. You know what they said? It's not happy, whatever. Oh, got it. We can repair, no problem. I'm talking about 1% dentist has a little bit problem. They all the time talking and blame the laboratory, negative, whatever. They never happy. You know that? Never happy. It's bad for them. I don't care. I just ignore it and move on, right? I have a problem. Always problem, right? Life. You don't have any problem? Everybody has a problem. But thank God we only have a couple problem a day. One. Move on. That's it. But the teeth, you have to consider great qualification dentists and Google it, and then they are qualified. Ask them dental laboratory which lab do they use it. So they have to give it to you the dental lab name. So when you get the dental lab name, so you can research with the Google it everything, so you can get some idea. I'm not selling my stuff. I don't have to, because I'm trying to let people know what we are doing here. I'm a right to ask the dentist is the correct one. I don't need the bad stuff. Laboratory, most of the dental laboratory realities here. You know what? Dental dentists say, they say do best you can. But my lab, kind of little different lab. They said, look, do best you can. And new doctor, for example, they send the full mouth cases and bad preparations. And we call them. And then we ask them. And then they want to do best you can, so we guide them. Okay, so we can save 10 teeth. We can do 10 teeth later, like that. We're trying to give them guide as much as possible. So which is a win-win situation, because I know their pain, because whenever they call the patient, full mouth case, at least 4 hours, or maybe 8 hours, or maybe sedation, they sleep. They cannot get a bite. So we're trying to help them, the dentist, as much as possible, so they can maintain their professionalism in that area. That's my goal. The why you have to choose a good laboratory. There's pretty good laboratory out there. I would say 20% laboratory out there, they're pretty good, meaning they're working with the heart. And then they have a knowledgeable, which is we work with the analog and digital together. Basically, laboratory have to know the natural tooth form and contour, just like naturalism as much as possible. Number 2, they have to mimic it with the natural teeth as possible. Number 3, they need experience to make the teeth as much as possible, especially occlusion contact. Then we make the great biting when they're chewing. So now our laboratory, you have to looking for the, I mean, I'm talking about me, so I'm all the time worried about cleansability, hygiene. And then two, longevity. I hate it. I'm 3 months later cracking, 1 year later crack. I hate it. Who doesn't like that one? Who likes that one, right? Nobody. And three, aesthetic. So three things, cleansability, right? And number two, longevity, for a long time. My patient, our patients, they're happy. They never contact me, which is I love it. Whenever they have a problem, they contact me immediately. Fine, I can help you, no problem. And then three, aesthetic as possible. Actually, number four, comfortable. Okay, looks whenever the teeth is all mouth is different. So glad God created all mouths differently. So that's why digital is not working, because digital is looks like sometimes I'm working with the digital and it looks like I'm dumb because I make the digital piano too set up. Oh, no. Tooth. That's why CT everything's developed, so we can make the bulky, make the under contour, over contour, create it, decrease size. Whenever they got the teeth, comfortable. So those things I'm really careful for that. So not only that is a confidence, and then the laboratory can provide it the best as possible, the triangle type. So dentist, patient, laboratory, all connect together, triangle. Okay, Trinity, kind of. So we help them, so that's why we can support you. It's kind of teamwork. It's not like dentist made it. It's not like dentist in the laboratory, so they're a technician trying to finish it. But only 5% dentists can pay laboratory high fee, which is over $100,000. Just master ceramist, easy. So dentists cannot afford it, right? Some dentists, I saw that probably I would say 2-3% dentists, they spending money. They're trying to make good. That's good. But most of the dental dentists, and they hire the technician, I would say $20 per hour, $25 per hour. So they do your work. Is it good? No. So it's totally different. Communication with your dental laboratory, and then we can give you the best product as much as possible. That's what I'm trying to conclude today. All right, see you tomorrow. Thank you.